So today we are talking about history of HIV and AIDS, and that is we are going to talk about the discovery of AIDS, the transmission from 1990s to maybe 2000 plus, yeah. So when and how AIDS was found, but some of the research are not really been published about how it started. So we're just going to look at what doctors assume or what researchers assume HIV started spreading, how it started spreading. So guys, if you have not subscribed, like the video, share, comment. Don't forget to turn your notification bell so that every time I post a video, you will be the first person to be notified. So the history of HIV and AIDS was initially shrouded in misunderstanding and fear. You remember when HIV started in early times, where they said that people with HIV and AIDS were supposed to go and maybe thrown in the river, or they were supposed to be left maybe in the forest and they die there, or maybe some animal could come and eat them, and there were a lot of so many fears. The people say that someone who is living with HIV and AIDS should not be into contact with anyone who is negative. Yeah, a lot of things were said about HIV and AIDS when it started in early times. So also we will look at some of the myths and misconceptions about HIV and AIDS, but in this video today, let us look at the just history of HIV and AIDS. So doctors are not exactly sure when HIV originated, when HIV started, but they believe it developed from a type of chimpanzee virus in West Africa called the similar immunodeficiency virus. So to mean that chimpanzee had that virus. So maybe when human being was in contact, or maybe you see they say that somebody slept with a chimpanzee in the forest and contacted HIV, which is not clear, or we don't know if it is true, but they believe that someone got into contact with the virus from the chimpanzee, that is HIV virus. Yeah, so people who wanted chimpanzee are the people who maybe came into contact with the blood containing the virus and contracted the HIV. So researchers believe that the virus muted at some point in the human body and became the HIV that we have currently. So the researcher collected the earliest detected HIV in 1990s from a man in the Democratic Republic of Congo. Later genetic analysis determined the virus might have developed between 1910 to 1930. Yeah, 1910 to 1930. That is how they assume. But also remember, they said that maybe hunters in the forest came into contact with the virus from chimpanzee, or someone slept with the chimpanzee. We don't know. So those are the things that they are assuming how it started, how HIV started. In the mid-late of 1970, doctor noticed that people in New York and California were contacting a rare form of opportunistic diseases. Remember, we also talked about opportunistic diseases, the pneumonia, the cancers, the TBs, the skin diseases, the frequent cough, the malaria, the salmonellas, yeah, You remember we talk about those opportunity diseases that sometimes develop. So in the mid-1970s, doctor noticed that people in New York and California were contracting rare form of opportunistic infections such as aggressive pneumonia and rare cancers. So people with weakened immunity, immune system were more likely to be diagnosed with this opportunistic infection. Yeah, and in healthy people, the immune response is enough to keep this condition at a bay. Yeah, remember when you are just normal person, some of the cancers you cannot contact, some of the pneumonia you cannot get them, some of the TB you cannot get them. Yeah, your body is able to fight off this. And you remember HIV is a disease that deal with your white blood cells to ensure that your white blood cells are weak and they cannot fight off infection. So doctor at the same time did not know the virus was the underlying cause of this condition, and later studies suggest that HIV was present in North America, South America, Europe, Africa, and Australia before 1980s. So between 1990s to 1980 to 1990s, misunderstanding about the virus and its transmission plagued the early years of the virus in the United States. So in 1981, doctors and researchers began to notice a set of symptoms in various healthy young male who had sex with other male. At first, healthcare provider called the disease gay-related immune deficiency. However, doctors also began to observe the intravenous drug users also experienced the same symptoms. In 1982, health experts realized that the symptoms and related conditions were due to compromised immune system. So they began to call it AIDS. Scientists, through those living with conditions such as Kaposi's sarcoma, a rare cancer, pneumonia that is called pneumocystic jirovecii, had acquired them through AIDS. So in 1983, the scientific community identified the virus responsible for AIDS. They first named the virus the T cells, because you remember we said that HIV deal with your anything that can fight off your the infection in your body. So remember, T cell is also a helper cells that help to fight off infection. So they called it T cell first. Later they called it lymphotrophic virus type 3 or lymphadenopathy associated virus. Later researchers changed the name to HIV, and they also identified the leading method of HIV transmission and learned that a person could contract HIV from casual contact. A person could not contact HIV from a casual contact like food, maybe water, air. Those were not things that a person might contact HIV through them. In 1985, the first international conference on HIV took place in the US. During the same year, the Food and Drug Administration licensed the first commercial blood test to test for the virus antibodies. The test was a simple way of diagnosing the condition. So blood bank also begin to screen their blood sample for the virus to prevent the transmission through the blood transfusion. In March 1987, FDA approved zidovudine, the first antiretroviral medication that could treat HIV, that could suppress the multiplication of the virus. Also in the 1988, the first World AIDS Day took place, remember? And the first World AIDS Day is in 1st of December. By 1989, An estimated 100,000 people in US were reportedly living with AIDS, which developed from untreated AIDS. You remember we said AIDS is the advanced stage of HIV, yeah? So there was 100 people living with HIV, with AIDS. That has, yeah, you can relate. So according to Canadian Foundation of AIDS Research, an estimated 8 to 10 million people worldwide were living with HIV by 1990s, before even I was born. In 1991, the red ribbon became the symbol of HIV and AIDS awareness. So the visual AIDS artist Kaku, the visual AIDS artist Kakas created the Red Ribbon Project to show compassion and support for people diagnosed with AIDS and their. So I was saying in 1991, the Red Ribbon became the symbol of HIV and AIDS awareness. The visual AIDS artist Kakas created the Ribbon Project to show compassion and support for people diagnosed with HIV and AIDS and their loved ones. So by 1995, doctors introduced the first triple combination therapy as a retroviral treatment. That is 1995. Yeah, that is when it was introduced. The retro means not the triple therapy, not the retro, the triple therapy. HIV, those are taking HIV drugs, they will tell you they usually take 3 drugs. Yeah, so that is when the doctors introduced the first triple combination therapy as a retro treatment. This combination drug prevented the virus from replicating. We said HIV replicate, which allow a person's immune system to fight off infection in their body. In 1995, FDA approved a type of medication called protease, and protease inhibitor as part of HIV treatment regime, according to the charity AVAT, in the area where the treatment were available. Now, the number of AIDS-related deaths and hospitalization decreased by 60% to 80%. However, in 1996, around 23 million people worldwide were HIV positive, and HIV has some were diagnosed with the AIDS. You remember, AIDS is the advanced stage of HIV. So in 1999, AIDS-related illness were the 4th leading cause of death worldwide, and they go and look for the first leading, the second, the third, and in this video just know that HIV is the 4th leading death. It was the first leading cause of death worldwide and the leading cause of death in Africa. Africa, we have problem. At this time, researchers estimated 14 million people had died from AIDS-related illness since HIV epidemic began. Now, 2000 to 2010, in July 2000, organization belonging to USAID, the Joint United Nations Program of HIV and AIDS, negotiated with the pharmaceutical company to make a retroviral medication more affordable to develop into developing countries. So they were targeting Africans because we are developing countries, and developing countries always have problem. So in 2002, the FDA approved the first rapid HIV test. With the test, a person can receive a result within 20 minutes that has 99.6% accurate. So in 2000 also show an increase in funding of supportive HIV research and also treatment. So a lot of organizations came in to fund the treatment and also the research about HIV, and it is still going on, and we have not found the cure. in 2008, the World Health Organization announced that the number of non-HIV cases had stabilized, meaning the number of people diagnosed with HIV and AIDS each year had not increased. As of this article publication, the number of people with HIV has remained stable in US. US, you know, it is a developed country and people are more exposed, people are not ignorant, people are educated, so they could listen to they could listen to and follow the preventive measures. In 2009, the FDA approved 110 retroviral drug, and in 2012 the same FDA approved the pre-exposure prophylaxis PrEP preventive drug treatment plan for those at risk of acquiring HIV. So those at risk of acquiring HIV are those who are sexual workers, if you have been raped, if you are living with someone who is HIV positive, are not taking drugs properly. Yeah, so the PrEP was introduced at that time, or was approved. During the same year, about 54% of people eligible for HIV treatment were receiving it. Today, healthcare professionals treat an estimate 99.5 million people with retroviral medication. In February 2015, CDC announced that diagnosis and proper treatment could prevent an estimated 90% of new HIV diagnosed in US. And in 2017, several organizations, including CDC, endorsed the Undetectable and Transmittable Initiative, which based its company on what? On robust evidence that people who receive antiretroviral medication and have undetected viral load could not pass on. This education and medical response have provided hope for those people who are living with HIV and their partner to live longer, healthy lives and without the risk of transmission. Now, researchers are also currently working towards preventive measures of HIV vaccine, a vaccine that could prevent the HIV, while the FDA has yet to approve any vaccine. They have not yet approved any vaccine, but clinical trials are ongoing. In addition, researchers are attempting to develop therapeutic vaccine to increase a person's immunity response if they could contact HIV. According to National Institute of Health, an estimated 30 people worldwide have participated in the studies of preventive HIV vaccine. The U.S. Preventive Services Task Force published updated guideline in 2019 regarding PrEP for the prevention of HIV in people with the virus. Doctors only consider PrEP for people who have recently received a negative result. So so for example, if you have you have been raped, or you are having sex, you had sex with someone who is HIV positive, and when you are going to get tested, you turn to be negative, but you have already been exposed. So PrEP is for such people. Yeah. The FDA approved only one formulation of PrEP. This formulation is combination of tenofovir, disoprovir, formulate, and it is not important also, but it is important for someone who is listening to this video. yeah, the PrEP is a combination of those tenofovir, this pop of, I don't know how to pronounce those words. So it is suitable for adult and adolescents who have high risk of HIV and weighing over 35 kilogram to get tested. No trial have no trials have taken place to study the effort of this formulation on pregnant people. However, FDA advised the people can use it during pregnancy if they discuss it with the doctor. So now we have looked at, we have seen how HIV started. Yeah, we have seen how HIV started. HIV started from people getting into contact with the chimpanzee and getting the virus. The virus mutate into human body and form HIV. Yes. And later we've seen how the first time it was diagnosed, in which country, Congo. Yeah, so many people have been living with HIV. Treatment has taken place. Yeah, a lot of organization has come to support the people who are living with HIV and AIDS. We have seen that a lot of research are still going on about HIV and AIDS, so that we get at least treatment or cure, and also maybe we get vaccination, and also we get long-term long-term, maybe, right now the triple therapy is for you take the drugs daily. So the researchers are, or the organizations are still working on how they can get maybe a medicine which can be taken maybe once in 3 months, once in 1 year. Yeah, you see that. So those are the things which are going on. Vaccines of HIV and AIDS still is not yet approved, but the clinical trials are going on. That is why you usually hear some people saying that in US they have the vaccine. It is not yet approved. Yeah, it is not yet approved, but clinical trials are going on. So I think that is what I have to say about the history of HIV and AIDS, how it started, the spread, the discovery. Yeah. So in case you have any question, write it in the comment section. Let's meet in the next video. Bye till next time.